Do you cough, wheeze, experience shortness of breath, or chest pain? If you do, chances are you have asthma. Asthma is inflammation of the air passages brought about by different triggers. There are many different asthma triggers. Examples of these are viral infections, bacterial infections, stress, exercise, cold air, allergy to pollen or dust, and cigarette smoke. If you experience the asthma symptoms, the best thing to do is take note of the pattern and time. This information will help you identify the specific trigger of your asthma. The good news is that asthma can be treated and managed. In fact, the National Heart, Lung and Blood Institute have established asthma treatment guidelines for the effective management of people with asthma. These asthma treatment guidelines give the appropriate methods of treatment that doctors must prescribe to their patients. If you want to effectively manage and treat the asthma symptoms, you and your doctor must follow these asthma treatment guidelines. There are 4 components in the asthma treatment guidelines. The first component is assessment and monitoring of asthma severity and control. This component is important because it will ensure that the right type of anti-asthma medications are prescribed and necessary adjustments can be made if asthma control is not good. The second component of the asthma treatment guidelines is patient education. Here, the guidelines call for a partnership between the doctor and patient. The doctor is tasked to educate the patient with the important aspects of asthma like causes, medications, prevention, and evaluation. Self-management education will improve patient outcomes because the patient is equipped with the right information. The third component is control of triggers. Triggers are the causes of asthma symptoms. If the patient knows what his or her triggers are, the right preventive plan can be made. The patient will know how to effectively avoid exposure to the asthma trigger that he or she is sensitive to. The fourth component of asthma treatment guidelines is medications. Anti-asthma medications are categorized into 2, long-term medications and quick relief medications. Long-term medications are used on a daily basis for effective asthma control. The specific long-term medications are corticosteroids, immunomodulators, cromolyn sodium, and netocromil, long-acting bronchodilators, leukotriene E modifiers, and others. On the other hand, quick relief medications are used when symptoms and exacerbations are experienced. Quick relief medications are systemic corticosteroids, anticholinergics, and short-acting bronchodilators. Furthermore, in the asthma treatment guidelines, complementary and alternative medicines are also tackled. Here, doctors are told to warn patients about the lack of sufficient medical data to establish the safety and effectiveness of complementary and alternative medicines. Doctors are also tasked to ask their patients if they are using any form of alternative treatment. Follow these asthma treatment guidelines to effectively manage your asthma symptoms.